Hello, this is Dr. Bouvier with Doctor and You. You came to this video to learn a little bit more about the process that we help patients take through to improve their disease state. We call it disease state management. And we use some of the state-of-the-art processes. We use QR code, and between you and your accountability partner, we tie that QR code to your record on your server. It's very similar to the personal health record, the book that you have with all your lab, x-ray procedures, and also medication, but it also is tied to our server, which has the same thing. So if you don't have your book with you, you can always use that QR code. So you'll be given a QR code. We'll put a copy of it on your record, your license, any other place that's easily accessible. We'll also put it on your cell phone under ICE, in case of emergency. So emergency personnel know to go to that to get vital information, especially if you're passed out. So let me give you an example of that. So let's say you go to the emergency room and you don't have your book with you, but you've got your QR code, where your QR code updates the medication record, any current lab, x-ray procedures, and consultants. They'll see any kind of medication changes. Why is this important? Because medication changes, and how we screw up the most in medicine is really if we don't get the medications correctly. So these ER personnel will have access to that information and in any other people that you want to give it to. That becomes vitally important when your life depends on it. So an example of this would be, you have your QR code, you had 3 or 4 doctors, they've made medication changes, and those medication changes are recorded on your record, all in your book, but all in your personal health record, but also on our server. So if another doctor wants your current information, they'll have it with this QR code, and you always have the QR code with you. So again, this is Dr. Robert Bouvier. This video is a little bit to explain a little bit more about our QR code process. Who are we going to use this with? To help people with hypertension, cholesterol, diabetes, weight loss management, some mental illnesses. Will help people, number 1, stay out of the hospital in the emergency room, and number 2, help you live longer and healthier. 2 great goals and examples of what we can do for you with this process. Again, this is Dr. Robert Bouvier with Doctor and You. Thank you very much.